For those of you who are joining us, thanks again. This is Chelsea Hellmeyer from Digital Dental Assistant Academy, and I'm here with Ronda Holman for our webinar tonight about Airway. She is a very experienced assistant and works with Ignite DDS and Ignite DA as well. So I want to talk about all those amazing things you're doing, especially Airway. Those of us who don't know you well, give us a little bit of insight into your dental assistant career and how it led you into Airway.
Absolutely. Chelsea, thank you guys for having me. I love everything that DDAA is doing over there. And I love that you said experienced dental assistant instead of like, she's been doing this for 27 years, you guys. Like, how? That's like last century she started. So yeah, it's been a minute. But I love it, and I love seeing the changes over the years. So I will talk about Airway in a minute, but just the evolution of the dental assistant and our role. Like, I remember being at practices and it was like the generation before us, right? And they were like, oh yeah, you used to answer phones, take payments, do the suction, do the ordering. Like you barely, it was just it didn't have a really defined role. You barely had a job title. And now, everybody is there. They've figured out, workflow and how each person, should be excelling in whatever it is that they need to do. I went to a CE in 2017. And it was a 7-hour course that was 2 hours away from my office. And we spent the entire day learning about oral sleep appliances, which was amazing because I didn't know that dentistry could have such a profound impact on someone's sleep. And I didn't realize there were so many people on a CPAP. And I didn't realize that dentists had the front seat to like understanding airway disorders and discovering them. And I didn't know.
Yeah, they're the only people that see them. A lot of times doctors are not even screening for this at all. So we're the only ones doing it.
I love when they say the dentists are the gatekeepers because they really are.
Yes, I like that term.
Oh gosh, because once you learn to see the signs, you can't unsee them. Which,
So when did it really click for you?
Well, I was driving home from the CE with my doctor, and I said, you know what? I said, we just spent 7 hours in that class, and not a single person told us why people can't breathe at night. I know all the appliances now. I know who to order them from, and I know what, different types of acrylic and resin they're made of, but no one said, why can't people breathe? And so it just started this rabbit hole that we went down together as a team. We'd buy books and I'd read one and we'd do a book exchange and then we'd find any course we could go to. What was really neat is like
I love that.
Yeah, we both just dove right in and we tried all kinds of different things, right? When you first get into Airway, you think it's really complicated because it's such a foreign concept. So we went to a mini residency in California with Dr. Bill Hang, where we did orthotropics. And then she did a residency with Dr. Nordstrom, where it was an ALF, so advanced light wire functionals. And then we did orofacial myofunctional therapy. We became Healthy Start providers. You name it, we did it. And it was really, it was one of those things like kind of putting everybody's piece of the puzzle together to really help our patients not only prevent dental dis-ease, but to actually stop the root cause of why they got to where they were.
Yes. And I love that that's where dentistry is going these days, where we're not just slapping a Band-Aid on it or saying, oh, you just snore or, oh, you just grind your teeth. We're looking at the underlying cause and we're treating them as a whole person now, not just this. So it's so nice to see people taking those changes and doctors going that way because like we said, we're sometimes the only people. I have seen so many patients who we have diagnosed with sleep apnea. It is unreal. And a lot of them are really skinny women, younger women, or someone like myself. There's no stereotype because I can tell you what, my airway disorders were completely undiagnosed. I still have airway problems to this day because of it. And mine were not caught as a child at all. They didn't caught that I was a complete mouth breather. I have a really narrow airway. I have a vaulted palate with tori on the back, and they were just like, yep, you're good. Bye. And now looking back, I'm like, how did nobody catch that? Like I wasn't sleeping good at night. I was a complete mouth breather. I had dry mouth all the time and all the problems that came along with it. I would wake up with headaches. I ground my teeth terribly. And they're just like, you ground your teeth from stress. It's okay.
Yeah, but
And
they
so I
didn't tell
love
you
to.
the stress was you're suffocating at night. Not because your dog
Exactly.
died last week.
Right? No, they're like, your brain literally is not getting oxygen at night. It's just crazy to think about that. Have you seen a lot of children when it comes to airway issues? Because that's one thing that I really thought was interesting when I started learning about airway was the amount of children that are diagnosed with airway problems.
Oh, it's so prevalent, you guys. I mean, so here's my favorite analogy, okay? Just as
Mhm,
a background. If a child's teeth come in crooked or crowded, it shows that the bone didn't grow enough for the teeth to fit. Okay? And why
mhm,
didn't the bone grow enough? Well, the tongue and the midface wasn't working properly. The muscles are dictating the bone growth. And
mhm,
then you think about, okay, well, if there's not enough room for teeth, there's probably less room for air in your nose because the roof of the mouth is the floor of your nose. And
mhm,
so I tell people, I'm like, this is rampant. Like, here's the deal. If I walk down Main Street and 8 out of 10 kids come out of these stores or walking around the sidewalks and they have braces on their legs, like Forrest Gump, do you think
mhm,
it'd be a little weird or like, what the heck, guys? What is happening? Why are all these kids wearing braces on their legs? Like, we
mhm,
got to figure this out because this is not normal. But because the braces are in their mouth, it's okay. Like, it's just a rite of
mhm,
passage, and we've gotten so used to it, like common but not normal. And
mhm,
so, yeah, I mean, it's right there. If the teeth can't fit, there's less room for air, and then there's a chance that they had oral motor dysfunction to begin with. And
mhm,
there's a lot of things that go into developing a smaller upper airway, but
mhm,
we're getting to a point now where I love. I went to the 2017 ADA conference for pediatric
mhm,
airway awareness, and
mhm,
Dr. Raphael said that the like appliances, right? These the growth guidance appliances that the kids are sleeping in now. He
mhm,
said they're going to become as ubiquitous as a toothbrush. So, because of epigenetics, our diet and our lifestyle and lack of nutrients, we are going to have children sleep in these to develop healthy upper airways until we can reverse engineer all the things in our lifestyle with mushy food and, you know, uh, bad habits like a pacifier or a thumb
mhm.
and mouth breathing because our environment is just congesting us from a young
So
age. I mean,
again,
these
it's
kids are just
just
all
a
snotty.
band-aid. Yeah, it's just
Yeah.
a band-aid to the problem. It's so many people have these constricted airways. So what are some of the main symptoms that you see in your day-to-day as a dental assistant and as someone that specializes in airway? What are the things that you look and screen for your patients?
Yeah. Okay. So step one, I look at their face. Do they
Mhm,
have venous pooling, right? Do they have like blood returning to the base of the eye? Do they have sclera, which means I can see the lower part white of their eye? Do
mhm,
they look tired? Are they hunched over? Do they have forward head posture, right?
mhm,
Is their mouth open?
mhm,
Your mouth isn't supposed to be open. It's the
mhm,
equivalent to like leaving your eyes open all night long. It's designed to be wet. And if it's open, you already know something bad's about to happen because the microbiome is going to get hit. It's going to get very acidic. So
mhm,
I'm looking at the face, right? And then the body posture. And then you jump into the mouth and you see like wear on the front teeth. You see recession. You
mhm.
see a scalloped tongue where there's like indentations because their
That's
tongue
always
doesn't
my
fit
number
their
one.
mouth.
Yep. Scallop tongue's
Mm-hmm.
always a key
Yeah.
indicator.
That tori like you're describing, like why is there
Mhm,
extra bone growing in your face? Well, it's because you're putting so much undue force on your body parts that it's like I don't know why she's clenching and grinding, but we're gonna throw some more bone down because we need to make this thing thicker.
mhm, mhm.
And you
Yeah.
looked at the red uvula, like the uvula's back there and it's just so big and squishy and that person's been snoring all night long. And then they
Mhm,
have the malempathies and you're looking at like all of these signs in the mouth that they can't breathe at night. We
mhm,
have mirrors where you put it right under the nose and you try to see if there's nasal patency out of each nostril. um,
mhm,
there's a simple thing that we can do just to confirm nasal patency is you sit for 3 to 5 minutes with a business card between your lips. If you can breathe 3 to 5 minutes with that business card between your lips, then you have nasal patency. It might need to be improved, right? You might be like, oh, I'm trying to switch to nose breathing, but I'm not getting enough air. So that's when
mhm,
we throw that's why I wrote the book. Breathe better
mhm,
while you sleep. We throw the kitchen
Yes.
sink at it, right? We get you learning how to
Hmm.
do nasal irrigation, nasal sprays, blowing your nose, humming, nasal dilators, like red light therapy. There's so many things that we can do
Hmm.
to get your nose to open up and work the way it was supposed to, because it's a use it or lose it organ. And the more you mouth breathe, the less you can breathe through your nose.
It's crazy to think about. I can tell, honestly, as I've gotten older, my mouth breathing has gotten worse. I am breathing less through my nose,
Mm-hmm.
more through my mouth. I have a drier mouth now, and that is actually something I am tackling. 2026 is my year that I am tackling this issue, and I'm going to do a lot of consulting. So I'm excited to be joining with you on a bunch of this stuff because I'm going to be asking you some questions as I go through this journey. So maybe I need to document that. What would you
What
say
would I
for
say
a
for a
dental
dental assistant
assistant who wants us to start learning and not really sure where to start? Where do we look to?
So you have to get your dentist on board. Otherwise, you're
Mhm.
not going to be able to use the knowledge that you gain in your
Mhm.
practice.
Yeah.
You can do like I did, where you can take to the internet, right? And just go
Mhm.
independent and rogue and start teaching people as an assistant to the masses. But if you
Mhm.
want to incorporate it into your day-to-day practice and become the airway champion of your practice, you got to get your
Mhm.
doctor on board, because you guys have to align in the way that you
Mhm.
communicate with patients when it comes to preventative care and looking at timelines and what your options are. I loved Airway Prosthodontics with Spear. Honestly, I don't even know if they're still doing it. Dr. Jeffrey Rouse, he was a brilliant guy. He taught us how to use the MyTap.
Mhm.
I really liked AOMT. So that's an orofacial myofunctional therapy program. So a lot of
Mhm.
times your dentist can bring you on as like a shadow, if you will. So you don't get certified in OMT, but you get to learn what they learn, test when
Mhm.
they test, and then it's very helpful because then you get to be, because I mean that's the thing. When you're working in a busy practice, that dentist needs to be working on teeth, right? They
Yes.
don't need to be sitting there talking to a patient. Like that's not their job. Your job as the patient educator, dental assistant,
Yes.
is to be the canary, right? You're the one who's
Mhm.
just reciting everything that your dentist wants you to. And as soon as you guys learn together and you know what to help your patients with, it's a lot
Mhm.
easier.
And it, yeah, it just
There's,
flows
I
so
mean,
much
Airway
better.
Circle, you guys, it's so much nicer. And when you learn together, you stay together.
Yeah.
I've never been with a dentist as long as I have with my dentist,
Mhm.
because she invested in me. I said,
Mhm.
"Hey doc, I want to go to this class." She's like, "Let's go." Who do we go to next? And
Love
so
it.
it was like, couples who play together stay together, you know. We were both ready to
And if
look at
you're
the
taking,
forest.
yeah,
You know, you're talking to Chelsea about that.
if you're taking that, initiative and you're telling them, this is the class I want to go to, this is where it is, I want to learn this and implement it, they're going to be so much more invested in you because they know you're invested in them. You want to make yourself better. You want to make the practice better. And that's going to make your job that much more secure. That's going to make you more invaluable to the practice. I'm so glad to see dental assistants, the role of it as it used to be. Like you said, we answered the phones, took payment, assisted, did all the ordering. And now it's, let's see what kind of skills these people have and we can hone in on them. And when you give people the opportunity to rise and give them the right tools and training they need, they can soar. Dental assistants can do so much if we can find the right team and synergy and have that doctor that supports us and we support them. I think we all have like experiences with doctors, that weren't so pleasant, just like doctors have experiences with assistants that maybe weren't the best. But there are so many people, like the people that are in the webinar today, and people like me and Rhonda who just love our jobs and we just want to be better and be more educated and make more money and bring better care to our patients. And that's what we all want at the end of the day, right? That's why we're in this field, is to bring better care for our patients.
Yeah, and I think that's one of the things. I've been with Ignite DA for almost a decade now, and
Mm-hmm.
it has been so rewarding getting to work with new dentists who, they're coming out of school. They don't, I don't know if you guys know this, they don't get trained to work with dental assistants. Like
I know.
it is a glorious happening when it, if a dental assistant's there for their boards, it's amazing. But they're not taught to lead. They're not taught to be a business owner. They're not taught
Mm-hmm.
all of these communication skills that you need to run an effective team. And so at Ignite, it's been really neat, especially in the airway part of it, is because a lot of these younger dentists are coming out knowing this stuff now.
Mhm.
Whereas, I got 40, 50-year-old dentists just now learning it, and it's a little bit hard to change your ways and to know that there's probably, a decent amount of your patients that you've neglected
Mhm.
inadvertently. Like,
That's a
because you
scary
didn't know
thought. Yeah.
anything. You didn't know any better. You just put them in a
Mhm.
night guard. Yeah.
Yeah. So, when it comes to Ignite DA and Ignite DDS, tell us a little more about how that works because I'm so curious about that as well. I know Ignite DDS helps newer dentists come into the world of dentistry, and tell us more about your involvement there.
So I am the chief igniter for the dental
Mhm.
assistants. So my
Okay.
role primarily now is to help the new dentist learn how to work with their assistant. The soft skills, learning, what they can delegate per state, how they can, communicate and develop this relationship so that it's more than a job. I want these
Mhm.
guys to be able to know what it takes to have a lifelong career with the same assistant.
'Cause it can happen.
Because if you don't do it right, yeah, you're going to end up having 8 or 10 the first 3, 5 years of your career, and you're going to be miserable and jaded, like you said, where
Mhm.
you're like, oh, I keep getting burnt. So my job is to help them define that role for their assistant, understand how to
Mhm.
delegate, and to become a team, like an effective team.
Mhm. I love that because it's less about I'm your boss, make sure you're handing this to me. But it's more about we're a team. I need you, you need me. We need to work harmoniously together to make this work. And when you can do that, it so shows off with your patients too. And it's so funny that you teach that because over the years, I've taught on and off over the years, and I've kind of, always mentored younger assistants that I liked who had a passion for it. But all of the dentists have always told me, I never knew how to work with an assistant out of school or like I don't know how to delegate. I don't know how to tell them what to do or where to even get started. So they're just kind of looking around and so you guys are there to kind of fill that void now about okay, here's school and then here's real life. How do we blend those nicely? I love that.
Exactly, because it's super stressful. I mean, especially because a lot of our clients they're coming out of dental school and they're becoming practice owners like right away. And
Mhm.
so talk about jumping into the deep end.
Mhm.
And it's just nice. We get to be the mentor. We get to say, hey, do
Mhm.
this, don't do that. Do this
Mhm.
first. This is a priority. Don't worry about that right now. The things
Mhm.
that you wish you had when you feel like you're on an island by yourself.
Yes, that's what we talk about at DDAA too. Like, we want to kind of be that person that we wish we had when we were learning 3D printing and digital dentistry. Because when I was learning scanning, oh my gosh, probably at least 12 years ago, more than that, I felt like I was all alone. I had no one to really teach me. I had a technician teach me, the guy that sold us it, but that's it. No one, I was just trying to figure it out by myself and I was just like lost. And I learned over the years, but it would have been so much easier had I had someone to help me. And I don't want people to have to struggle like I did. So that's nice to see us as a professional coming together.
Well, I think about this, Chelsea, all the time. Imagine
Hmm.
I'm a dental assistant. My
Hmm.
doctor buys all this tech. They learn how to use it. I don't. They bring it back to the office and they say, you know what? I bet you could do this job. Here, watch me. And they don't really show you the right way. They just show you the way that they remember. And then you
Hmm.
mess up. And then the last thing in the back of your head is like, how much does this cost? How much is that resin? Like, blah, 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 blah. Like, here I am. I'm basically guessing at what I'm doing, and I'm
Hmm.
ruining a lot of I'm wasting time. I'm not efficient, and I'm wasting
Yes.
product.
Hmm.
So I think it would behoove dentists to realize that some formal training is very helpful, not only for the bottom line, but for productivity and for keeping a schedule. Because the last thing a dentist wants to do is start and finish a patient all by themselves because the dental assistant's trying to figure out how to print something again.
Hmm. You know what I call that? I just call that setting our assistants up for failure. When we don't have good protocols and good systems
Yeah.
and they don't get training, and the only training they get is maybe from a dentist who, frankly, doesn't know how to train, doesn't remember everything. For whatever reason, it doesn't get communicated enough because he's training her between patients and at lunch and for 5 minutes after work. That's just setting us up for failure. So, of course, we're going to have bad experiences with assistants when frankly, in our profession, I feel like sometimes we are set up for failure a lot. We are thrown into situations and told, just figure it out. And I think a lot of assistants like me and you went in there and figured it out, but it is not easy to do. So me and you both, we want to help those people so they don't have to struggle like we did and have to just figure it out on their own. Because I did a lot of that. Like I would
Yeah.
sit at home on my TV and watch YouTube videos, and my husband's like, why are you watching work videos on YouTube? Like, you're not even on the clock. I'm like, but I want to get better and I want to do more because then I can make more money. I can take my testing and get my expanded functions and provide more for my family, and the day can run smoother. So why is it a bad thing that I want to learn? But now at least there are people like Ignite DDS, Ignite DA, DDAA, and we can all work together and fill those education gaps, because there are some big education gaps, I think.
Yeah, absolutely. Especially when it comes to airway.
Yeah.
Your tongue should be
I
suctioned to
learned
the roof of your
nothing.
mouth from the tip to the back, gently at rest.
I learned that maybe 7 years ago, if that. I mean, I was taught nothing about airway in dental assisting school, nothing whatsoever. And for TMJ, we were basically told, oh, sometimes people grind their teeth because of stress, and then you give them a guard. And sometimes those people have sleep apnea, but it's usually just the older, large men. That's it. That's what we're told. How many people did we miss? And how many? So you could tell us what problems our patients will have when we don't catch these things, and what are the really long-term health effects of that too?
So, number one is cognitive decline. So, the way the brain cleans itself is during certain phases of deep restorative sleep. It's called a lymphatic system. And the problem is, if you're suffocating all night, you stay in light sleep and you don't get the restorative phases of sleep to clean your brain. And so, what we know is beta amyloid plaque, which is what's accumulating in the brain of people with Alzheimer's, is
Mm-hmm.
one of the reasons that it's so prevalent now. It's rampant how many people. And it's I think this is just a really fun story. I had a patient. She was like 86, and her son brought her in and said, hey, my mom is snoring at night and she can't remember much, like, we're really worried about her. Can you help? And I'm like, yeah, okay. So we got her scanned, and I got her a sleep appliance. And when I delivered it, I said, listen, this is going to help you remember more yesterdays. And sure enough, she started breathing better while she slept. Her brain was able to wash itself, and she started to recover from some of that cognitive decline. And that was like, wow, this is dentistry working on people with like dementia.
It's
And then you think about
amazing.
people with high blood pressure. Yeah, high blood pressure is not, so they're like, "Oh, I have high blood pressure." We see this all the time in dentistry, right?
Mm-hmm.
And you're like, "Oh, okay, well, what are you doing for it?" They're like, "Oh, they got me on a medication." I'm like, "Okay, but you do know that high blood pressure is not a condition on its own. It is a symptom of something." And they're
Yes.
like, "Oh, no, I didn't think about that. They just told me I had to take this pill." I'm like,
Putting a
"Okay, but
band-aid
what's
on it.
causing the high blood pressure? Could you be suffocating at night?" Mm-hmm.
Mm-hmm.
And then,
Yes.
I think about just the people spending all of their hard-earned money on their teeth. They're getting recurrent decay, they're having all these issues, and
Mm-hmm.
it's because they're clenching and grinding at night, or because their mouth is dry and the pH is too high. And they can't, they're like, I do everything you tell me to do. I brush, I floss,
Mm-hmm.
I avoid sugary foods and drinks. I haven't touched citric acid in 2 years. Why am I still getting decay? And it's because the oral environment itself is in dysbiosis, because you are using your mouth to breathe with. It is
Mm-hmm.
designed for eating. Your nose is designed to filter, humidify, slow down the air, get it ready for the lungs. Like it's a filter. Your
Mm-hmm.
mouth can't filter the air at all. And so every time you take a breath, you're just using your upper chest, right? And you're taking in cold, dirty air. So you're going to chronically be declining. Like there's no way to thrive when you're using your body wrong.
Wow, what an amazing way to put that. That you're using your body wrong. And of course, you are going to cognitively decline when your body is not functioning properly. And when you can explain it to a patient like that, and especially as assistants, because a lot of times the patients look at us, I think, and they're like, Do I really need to get tested for sleep apnea? And if we can inform them about these things, they're going to, I think, in my opinion and my experience, more likely to follow through because they hear it from the doctor, they hear it from us, and then maybe they visit their primary and their primary is like, oh, yeah, I didn't screen you for that. But speaking of that, you do need to get checked. So, being able to communicate with our patients about the long-term effects with it, I think is so incredibly important in building those skills to communicate with patients because nobody wants to pay thousands of dollars to get this treatment done, but they also don't want to be paying thousands of dollars for
Mm-mm.
fractured teeth and crowns and heart disease and high blood pressure and all these other things later down the road that we could have just prevented if we would have screened them for airway problems. Isn't that just crazy to
Absolutely.
think about? Yeah. So what do you think that you would tell your younger assistant? All these years that you've been doing this with all of your experience, what are a few like little gems that you would tell a younger assistant who is very green, um, has more of a basic training, but really loves the job and wants to learn more?
Number one is you will never know as much as your dentist knows. They have 4 years of undergrad, 4 years of higher education specific to the mouth. You will never know as much as they know unless you go to dental school. So stop comparing yourself to them. You will
Yeah.
always feel a little unsure, but you're supposed to always go to them as, they're your boss, they're the leader, and it's okay to ask questions and double
Mhm.
check. And it's not a weakness, you guys. It's
Or to
it's
even
just
ask for
part of
feedback.
the job.
Mhm.
Yeah. Be open-minded to it because it is what it is. Like they're expecting
Mhm.
you to know what they know, but you can't. So just go easy on yourself. It's a very hard job, especially when
It
you're trying
is.
to read somebody's mind that has 4 years of education more than you do.
Not only you're trying to read their mind,
I
but they're
guess,
watching your
yeah,
every move all day long.
yeah. It's very intimidating. And there was so many times I would go home and cry in my car. And I'm like,
Mhm.
man, I can't believe I messed that up
I bet.
again. And it was because I wasn't being taught properly. I wasn't doing stuff because I knew how to do it. I was doing stuff I was told to do. And so that was perpetually making me insecure. It wasn't until I finally found the right doctor who started learning with me that I'm like,
Mhm.
I know why I'm doing it. Like I don't have to worry about messing up because there's no way I would do it that way. Like that way doesn't make sense because I've actually learned how to do it.
And that's why we need more education for dental assistants. There are so many programs out there to help doctors and to help hygienists to learn and move forward and take a stand at their careers and all these things. But then it's assistants and it's like crickets. Assistants are such an integral part of the team. Like they could not survive without us. No, nobody's better than the other. We're all just part of this team that has to help each other balance out. And we have to stop thinking of ourselves as like just assistants or, oh, that's good enough. That's fine. When we raise the bar for ourselves, I really truly believe we raise the bar for our profession. When we start taking ourselves really seriously as medical professionals, which we are, then we raise the bar and the standard. The respect comes with it, the pay comes with it, but we have to do this for ourselves. No one's going to come in and save our professions and say, everyone stop picking on the assistants. They're actually phenomenal and they work really hard and they need some more education. Nobody's going to come in and do that for us. So we have to do it for ourselves and advocate for ourselves and take ourselves seriously. And I really found, I don't know about you, but I started assisting when I was 19. I was very immature, to be honest, when I started. I got involved in office drama. I thought I was smart because I could work really fast and I could hustle, but maybe I wasn't actually giving the best treatment to my patients. And then when there was this shift in me where I started slowing down, taking my time, and really starting to think of my job as a medical, and I'm not just here to make a paycheck. I am here as a medical provider, as someone to help the medical provider. And I need to take that really seriously when it comes to sterilization, patient communication, everything. And there was this shift in me, but then there was this shift in the people around me too, where they started taking me more seriously and I got more respect from people. And then I got my raises when I asked for them because they told me, you take pride in your job and we can tell. So I think when you can go from that shift from just an assistant to an amazing assistant who really takes pride in her job, your whole world can kind of shift a little bit.
That's part of the battle. I mean, you see, Chelsea, is
Hmm.
we want to get people to care about their jobs.
Yeah.
And it's a tricky situation because we don't have universal licensure. Every state is different.
Hmm.
Some doctors let their assistant do way too much. That's not even legal.
Hmm.
And other doctors don't let their assistants do anything. It's a very tricky. I mean, it's not like we're a radiology tech where if we go into any hospital ER, it's all the same. You know, it's cookie
Hmm.
cutter.
Oh,
So
it's so different.
there's an uphill battle there. Yeah.
Yeah, we're gonna be fighting an uphill battle here, Rhonda, together, me and you. But I'm here for it. I'm excited. I'm ready for assistants to really take pride in their jobs and to be able to even specialize in something. I love the idea of assistant specialize in something, whether you're specializing in 3D printing like I do, or chairside milling, or even airway like you do. So I've seen a lot of the stuff online about you being the Airway Champion and these mouthpieces. Tell me more about that. This is what I was really excited to talk.
So, like oral sleep appliances. So, is that what we're referring to? Like mandibular
Or no, no,
advancement
no,
devices?
your
S-
nozzle that you have. The I apologize, I can't remember the name of it off the top
Oh,
of my head.
oh, you want to work out? Okay, we can work
Yeah,
out.
I want to work out.
So, here's the thing. Our tongues are too weak. They are not
Mhm,
holding up our soft palate while we sleep, and that is
mhm,
making it hard for us to get like air in and out of our body.
mhm,
If your
mhm,
mouth is open, your mandible and tongue drop back, and it makes the tube behind your mouth, past the teeth, get small. And the smaller this tube, the harder it is to breathe. Sometimes the tube gets so small that it closes off, and that's what you call sleep apnea.
mhm,
So, this being one of the main driving factors to why this airway would go from round to flat is the tongue. And
mhm,
so I am affiliate with the Remplenish Myonozzle. It's a company that they only do workout straws. They are targeting the back of the tongue so that you can breathe better while you sleep. If your tongue is stronger and can stay suctioned to the roof of your mouth while you sleep, you're able to breathe through your nose. And if we can get your tongue up and out of your airway, you have a bigger tube to breathe through. And so I love this company, the Remplenish Myonozzle. There's a bunch of other tools that I really like too. Like there's a
mhm.
company out of Australia and they have this one, it's called a Myo Munchie. And
What's
so
that?
it's a bilateral mastication appliance. Half the reason our upper airway muscles are weak is because we don't chew like we once did. 200
Mhm,
years ago, prior to the Industrial Revolution, we had to process our food in our mouth. And so these
mhm,
muscles are designed to get worked out, and we're not working them out with Cheez-Its. So these are really nice to help your tongue and upper airway muscles in general and your lips get stronger. I really like, so half the reason people's got a, like, we were talking about this earlier, where it's the pacifier and the thumb.
mhm,
We're learning to swallow improperly as babies
mhm,
and nobody catches it, right? And
mhm,
so half of the reason the back of our tongue is weak is because we're not swallowing the right way. We weren't trained because we were given mushy baby food instead of baby led weaning
mhm,
and pacifiers for more than 6 months. I mean, everybody has a story, right? Or a
mhm,
tongue tie that never got clipped. But this is called a froggy mouth. And it's a device, it's a neuromuscular appliance that trains your tongue to swallow properly while
mhm.
you're, watching a screen or reading a book.
That's
So
amazing.
these two alone can help the majority of oral motor dysfunction so that yes, you can address the teeth and you can address, all the cranial concerns, but function first. Let's go to why this happened. Why don't my
Mhm.
teeth fit? Why are they
Well,
breaking prematurely without me doing anything to instigate it?
That's amazing that you can do something so small, such as a little tiny device or a straw, and you're doing therapy on
Hmm.
yourself every day to do that. And just something that minuscule, because we used to think, okay, they need to go to a specialist or they need to get surgery, extreme surgery to fix their airways or something like that. When really it's just a matter of retraining those muscles. Like you can, if I really wanted to, I could go back to the gym and retrain my muscles to how they used to be pre-baby, and I could do it, but it's going to take some work, you
Yep.
know. But it's just amazing to think that so many problems that come from it are undiagnosed and then can at the same time be treated so easily, and it improves so many areas of our patients' lives. I did some temping at a TMJ specialist, and these patients would come in with fibromyalgia, severe migraines, patients that almost got implant devices to help with their migraines, but no one scanned them for sleep apnea. No one measured their oxygen level at nighttime to make sure that their brain was getting the proper amount of oxygen. And you would find these patients that come in. I was there for like 3 months, and I would see patients come in day one hunched over, like you said. Their eyes were droopy, they were tired, they're hunched over, their mouth is open, and they leave 2 months later after getting treated and having some therapy treatments, using devices if they need to, and they just walk out 2 months like a totally different person. Like they're just like 10 feet tall all of a sudden, smiling at everyone. And you're like, how does everyone not know about this?
Yeah. I mean, if you're living in chronic pain and dysfunction and every single day of your life you wake up tired and you don't even know the difference. Like up until 37, I never had a good night of sleep. I can never remember a night where I just went to bed and then woke up the next day. I had to get
Wow.
up several times to use the bathroom. I was clenching and grinding my teeth. I was waking up to drink water. Like, what is wrong with my life that I have to drink water in the middle of my night? And I didn't know what I didn't know,
Mm-hmm.
and then once his sleep started getting better and I could breathe better, like it was like, wow, this is what these people feel like when they wake up.
This is
How did
what
I
people
not know
actually feel this
that my
good.
sleep was so bad? What?
Yes,
They don't
absolutely.
have to have coffee?
When I started wearing my occlusal guard, I was like, I was clenching my teeth that hard. I was waking up with headaches every day. How was I doing? How was that normal? And nobody was screening me for it. My doctors never, my regular doctor physician never asked. And I just got passed through. Not that it was anyone's fault, but now we're finally at this point in healthcare and dentistry where they're coming together back again. Everybody's realizing the head is connected to the rest of the body, and we need to be treating them as a whole person.
Yeah, the interdisciplinary part has been really neat. Finding an
Mm-hmm.
airway focused orthodontist in my community, or the ENT that I can refer all my patients to because they won't think that we're going crazy over there. Or, the optometrist who's like, hey, my patient's getting cataracts or glaucoma. Why don't we get them sleep tested? Like, maybe you can make them a sleep appliance. Like, it is just so neat to see everybody's discipline come in, realizing
Mm-hmm.
that we're all fighting the same problem.
Yeah.
Suffocating humans.
In simplest terms, yeah, honestly. And if you would have ever told me that 15 years ago, and I've been doing this for about 15 years, I believe. And if you would have told me that we're all suffocating in our sleep, we're depriving our brains of oxygen, it is giving people dementia, it is causing thyroid problems, it is causing high blood pressure, all of these issues, I would have been like, you're crazy. We're not suffocating in our sleep. We sleep fine. What are you talking about? You're
They're breathing.
crazy. Yeah, they're breathing. They're fine. What are you talking about? But now I'm like, man, how many patients could we have helped if we know what we know now? Not that that's what we should focus on, because we should really focus on how do we go from here on out. So how do you suggest an assistant leaves if they are leaving this webinar and they're like, I want to learn more? How can they even start screening their patients? What's the easiest way for them to start that conversation with the patients about how and why we are screening them for sleep problems? Because I've had patients yell at me before, and when I said, oh, do you have medical conditions? They said, oh, I have diabetes, but it's fine. And I said, what was your last A1C? And then I got yelled at and told that it was none of my business what their A1C levels were.
Yeah. I mean, it's a delicate thing that you have to weave through. There's two things that I was given advice. We train through Awaken to Sleep. It's an office in California. They don't really do consulting anymore, but Michael Cohen, he's the director. He said the way you approach this is you say there are some signs and symptoms that you might be struggling to breathe while you sleep. Would you
Mm-hmm.
like us to set up a sleep test to rule out sleep apnea? And they say yes. They don't want to know the ins and outs. They don't want to know, like, you can show them pictures, but at the end of the day, it's just, would you like to rule out sleep apnea?
Mm-hmm.
Because human beings innately don't want to find out something is wrong with them.
Yeah.
They are accustomed to that, right? Every time they go to a doctor, whoever it is, they're going to tell you what's wrong, how much it costs to fix it, how long it's going to take to fix it, you know,
Hmm.
and nobody wants to find out, oh, there's even more wrong with me.
Hmm.
So ruling out sleep apnea is huge. And then
Hmm.
as the dental assistant, I mean, you have that chance. I'll have patients come in just for a consult. We'll go over a packet. Like I print out everything, proper swallow, exercises for your tongue, how to
Hmm.
do sleep hygiene, right? Incline the head of your bed, sleep with cervical support, how to just nasal hygiene. You would be, I am shocked how many people barely know how to clean their nose. You know what I mean? Like they don't
Hmm.
even blow their nose right half the time. And it's just it's one of those things we just it needs to be like hand hygiene. We need to teach them A to B to C. If your
Hmm.
nose isn't unclogged after you do this, then do this. If you're eating something that's clogging up your nose, please stop eating it. Like our
Yeah.
priority is to make it as easy as possible for you to get air in and out of your body so that whatever we have to do in your mouth can be a final fix for the most part. You know, nothing's guaranteed, but these people are, you know, they're breaking their front teeth over and over and over. And like, they're like, why?
Well, or
You
they
know,
get mad at
it's
us
just, they
saying,
keep getting short no
what did
matter
you
what I
do?
do.
Hmm. Yeah. I think that's
Yeah,
such a
they're
great way
waking
to go
up and
about
their
it.
teeth are chipped. Yeah.
Hmm. That is why I also love doing
It's a great
photos for
way
all of our
to,
new
mhm.
patients too, because then they can't
Yeah.
be like, I was in here in my prophy and you guys chipped my tooth. And we're like, we screened you for sleep apnea and we took these photos and we talked to you about your dry mouth. And, it's a good way to protect yourself too. And I really like how you said it's going to ensure that the work that we do lasts, because how is any good dental work going to stay if they have the pH in their mouth is thrown off, it's dry, they're hanging open all night, they're not following all of our instructions? That work is going to degrade a lot faster than a healthy mouth.
Absolutely. It's like the people that do the is it retinal serum and they're like, don't go in the sun, you'll get a sunburn. But had you not told them that, they go in the sun and get a sunburn. Like, oh, what happened?
Mhm.
Like, you shouldn't have gone in the sun. I told you.
Yes. Oh, all right. And my last question for you. What what and who are you outside of dentistry and airway? Tell me about that, because there's always I love to get to know people more on a personal basis too and what you do. Or is dentistry and airway your whole life?
Um, I'm very invested in Airway. I spend a majority like okay, for an example. So it's Saturday morning, like most people are just like vegging out, and I'm on a webinar about tongue ties. And you know, my husband's like, what are you doing? I'm like, I'm learning. And so, yes, I'm a little obsessed with Airway because in order for me to be a true expert, I have to understand this on a fundamental level and I have to be able
Yes.
to communicate a very complex condition that has a broad spectrum and I have to make it simple to understand because if you
Mhm.
talk too far over people's heads, it sounds like won't, 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 won't. And
Mhm.
so my job is to find relative terms, give analogies that make sense to humans. Assistants, like you said earlier, we're the translator, right? Sometimes the
Mhm.
doc comes in and the patient's like, what's wrong with me? What'd they say? And then you have to be like, oh, well, turns out your air filter's wrong. You know, we thought it was
Mhm.
just a little dirty, but it needs to be changed. And
Mhm.
so outside of that, I'm a mom. I have a almost 18-year-old daughter and a 12-year-old son, and I'm a
Aw.
wife, and I live in Montana. And I love crafting. I love making things. I mean, Chelsea, you love making
You're a
things. So
busybody.
we
Yes.
align on that. Yeah,
Yes.
I loved. Yeah, um, we're small business owners. So my husband and I own a restaurant and a bar and casino. So when I'm
Oh my
not,
god.
you know, obsessing about airway or teeth, I'm working there.
So you are never not working, is what you're saying.
No, I'm only here for a little bit. I mean, the average human lives 100 years if they're lucky. So I
Yeah.
don't have a lot of time to spare. I got to make an
No, I
impression.
love it.
I
I
have to
love
leave it
it. I
better than
love
I
it.
found it.
That's perfect. I think we'll end with that. Like, let's just leave the world a better place than we found it. Let's take our job seriously. Let's give some great dental work, because at the end of the day, we all want to help patients. That's what we're here for. We are caretakers. As assistants, we're all caretakers, or we wouldn't be in this job. But let's just leave the world a better place than we found it. I love that.